Hey guys, I'm Dr. Paulina, and today I'm going to be watching an episode of Night Watch of a little girl with a fever. So let's go ahead and get started.
So the 500 block for a 5-year-old with a fever.
This is really a really good point here. What is a fever in a child? Parents will come in all the time like, oh, my child has a fever. And then you ask them, what is the temperature? And they're like, well, I haven't taken it. I'm like, okay, how do you know that they have a fever? It's really important to take the temperature. Anything above 100.3 or 38 degrees Celsius is defined as a real fever. So this is our threshold for a lot of things. If we're gonna do more of an infectious workup, if we need to think about more serious bacterial infections. So this number is actually really important for us to get.
The first thing that runs through my head when you tell me that there's a pediatric patient with a fever is, how high is that fever? Are they gonna have a really rapid increase in the fever and have a seizure?
What he's talking about is febrile seizures, and febrile seizures are very common in young kids because their neurological system is a little more immature. Essentially, in this age group, a high fever can actually make a true seizure come on, and that's what we call a febrile seizure. And like I said before, if you have a child that's under the age of 3 months or 90 days, that is a medical emergency. So a real fever above 100.3 is an emergency, and you gotta get help right away.
Can I take your temperature, baby?
So what happened?
Yeah.
She's had a fever for a couple days?
Okay, so one thing that makes me feel good about this is that the child has already been fevering for 3 days, which means that this is not like the fever came on really fast and now it's really high and we're about to seize. Probably what has been happening is that the child has been getting worse. We don't know if the child has been getting Tylenol or ibuprofen, so we don't really know too much yet.
Yeah, open your mouth. Put it under your tongue, under your tongue. All right, close your mouth. All right, baby.
Okay. How high was it?
101.
So one of the great things already that I'm seeing is that the patient is awake, the patient is following commands, which means that neurologically speaking, most intents and purposes, they're intact. So that makes me feel good.
I mean, like, a fever is technically 100.8 or above. She's at 101.0.
So yeah, that's a real fever, 101 degrees. Basically, a fever in itself is not a medical emergency. If this was like a patient who was not responding, like I said earlier, then you would have to worry that something more serious is going on.
Yeah, grab a thermometer and get some Tylenol and some kids' Motrin and alternate them.
So the EMS team has instructed the mother to give the child some medication for fever. So Motrin is your ibuprofen, Tylenol is your acetaminophen. It's very important that kids get the right dose for their weight. The reason why that's important is because if you're not giving enough, then the fever will just come back. And if you're giving too much, then you can cause damage to the kidneys or to the liver. So it's really important that you're giving it at the right times and the right doses. For fever, usually we recommend alternate the Motrin and the Tylenol. So each one is given every 6 hours, but you break in between with one or the other. So for example, if your child had a fever at 12 p.m. and you gave them Tylenol, the next dose is not till 6 p.m. But in the middle, you're gonna give Motrin at 3 p.m. to kind of help them stay fever-free in that time range. And then you keep going like that.
It happens all too often that new parents call because they're concerned when it's something that can just be taken care of at home, nothing that needs an emergency room.
In our nursery, we always talk about fever in a newborn and what is considered an emergency and what is not. And I think, you know, if you have a good pediatrician, most pediatricians will review that when you go to your child's wellness checks. Not every fever, like the EMS person said, needs to be seen in the emergency department. It's just like what to look for that is concerning. And obviously this is the middle of the night. They could have gone to their PCP's office earlier that day or like an urgent care, because it is not cost effective to call EMS team to your home when you could just easily drive somewhere nearby and basically get the same care.
Okay.
Okay?
Yeah.
Yeah, you'll be all right.
So, Mom, why you call it the ambulance?
Someone getting snappy.
The little kid was spot on.
She was
So
worried
she's
about you.
making sure
she's
you're okay.
awake.
So you gonna take the medicine
she's
your mama
good.
gives you?
I think the main thing at this point is like if the kid is keeping fluids down, they're keeping the medicine down, and you don't see anything else that's concerning. Basically, the name of the game is just rest, fluids, and Tylenol, ibuprofen.
Yay.
Listen,
Let me just unbuckle
you gotta
now.
take it from me, okay? You take it, it's gonna make you feel better.
What I see works best for most children is to do it in a syringe. So if you have a little syringe, just kind of do little squirts at a time, because that kind of lets them taste it a little bit, instead of like if you shoot it right in, then they're just gonna spit it right back out. Whereas if you do it little by little, they realize that maybe it doesn't taste so bad, and then they're more likely to take the whole dose. So that's it for today's episode and reactions of Night Watch. I hope you guys liked this content. If you did, make sure you hit like, share, and subscribe, and I will see you in the next video. Bye, guys.